Free healthcare for illegal immigrants in Canada. I'm Brian Lilly with the Rebel.media. There is a push by an organization called OHIP For All. They want you to believe that their goal is to make sure that people who might fall through the cracks, live on the margins, that they're not left behind by our universal healthcare system. The reality of the fact is that this is a coalition of far left-wing groups who have one goal in mind, and that is free healthcare for illegal immigrants, people that came to the country not following the law, who live and work in the country but don't pay the taxes that help pay for the very healthcare system they want us to use. Take a look at the website for this organization. It has a stunning statistic on it that I think will shock many Canadians. In Canada, it reads, we believe we have a universal healthcare system, and yet there are an estimated 500,000 people who do not have access to healthcare coverage. And why wouldn't they have access? Because they are illegal immigrants. We think of this as mainly an American problem, something that happens south of the border. But this group acknowledges 500,000 illegal immigrants in Canada, many of them in the Toronto area. Thus, the push for OHIP, the Ontario Hospital Insurance Plan, being extended to cover people who aren't citizens, who aren't permanent residents, who aren't refugees, just people that came and never left. They want to make you feel like this is something that should be the right thing to do. But is it? No, it would be rewarding bad behavior. It would be rewarding people that break the law. Now, if you look at the group list of supporters on the organization's website, it shouldn't come as a surprise. You've got the Ontario Coalition Against Poverty, a far-left group that has used violence in the past to try and achieve its means, and the group No One Is Illegal. This is an organization that simultaneously holds the belief that we are all illegal immigrants here, that we're living on stolen native land, but that we should also have open borders and everyone should just be able to come here. I remember interviewing one of their representatives at Sun News. They told me that they don't recognize the Canadian state, and yet here they are calling for the province of Ontario, part of the Canadian state, to extend health coverage to people that don't pay the taxes for it. This is a bad idea, but unfortunately it's the type of thing that we've already seen in progressive-run districts in the United States of America. Let's just hope that despite his promise to review this and give it some real consideration, that Health Minister Eric Hoskins realizes it will only get worse. Canada has just signed an agreement with Mexico to lift visa requirements. Last time we didn't have visa requirements on Mexican nationals visiting Canada. Refugee claims spiked up to 9,500 a year. The success rate, the acceptance rate, was just 11%, meaning we had about 8,000 bogus refugees coming into the country every year. What do you think they're going to do if we start giving out free health care to illegal immigrants? The system will only get worse. It will become bloated, overwhelmed by people not paying for it. This is a bad idea that needs to be stopped.
Thanks for watching. Click here to never miss a Rebel update. Want even more of the Rebel? Well, click here to become a premium member.